Hello, my name is Dr. Mary Ciccarelli with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to offer ways to accommodate the rooming process for individuals who need special assistance. Individuals with intellectual or developmental disabilities, often called IDD, may have differences in communication or thinking abilities that can be challenging for the rooming process. Ideally, the front office staff has notified you of their arrival and any specific accommodations. When you call an individual back from the waiting room, speak directly to the individual. Show warmth and patience. Speak slowly and use simple words. Don't speak too loudly. You should acknowledge any helpers they have brought with them and ask the individual whether he or she wants their helper to come with them for the visit. You should also verify the role of the accompanying person. The person may be a legal decision maker, a trusted friend or family member, a paid caregiver, or a person who's only providing transportation and actually doesn't know the patient well at all. Next, determine how the individual communicates. Use simple speech by choosing words with 1 or 2 syllables. Try to avoid 3 or 4 syllable words. Use concrete language. For example, say, "Come with me," rather than asking, "Are you ready?" If an individual does not respond to you directly with speech or gestures, ask if you should speak with their helper instead. If they have a communication device, ask the individual to show you how it works. If possible, document the individual's preferred method of communication in the medical record. Some individuals may be fearful of their doctor's visits and present with resistance to checking vital signs. This is often the result of prior stressful encounters. There are measures you can take to help ease their fear. If the individual has a comforter, like a stuffed animal or other precious object, show interest in that object. Use positive reinforcement and focus on the individual's abilities. If the individual displays resistance, allow a little break, 5 to 10 seconds, for some deep breathing. Demonstrate as simply as you can what you are asking them to do, and then praise any attempt at cooperation. If you have difficulty understanding a person, you may repeat back what you understood and ask for confirmation. Or you can respectfully ask the person to restate their response. It is important not to pretend that you understand when you don't. You might also ask permission to have a helper clarify if you're still struggling. Once you've introduced yourself, take the patient to check their weight and height. Walk next to them, using gentle touch guidance if needed. Explain each step of the process with simple language. Have the individual remove their shoes, then assist them in standing on the scale. For patients with mobility issues, you may need to adapt how you check height and weight. Stepping onto a rather small scale can be difficult. But if possible, use a scale that has a bigger standing area and maybe even a handrail. Make sure the person is steady before you let go. If available, you could have an unsteady person also use a seated chair scale. If you need to weigh a person in a wheelchair, use a wheelchair scale. Remove any unnecessary baggage that's hanging on the chair. Take the weight, then ideally have the person transferred to an exam table or another chair and weigh the empty wheelchair. To make it easier to have future weights, record the chair weight in your health record and also on a sticker, which you can attach under the wheelchair seat or on a crossbar. Once you've completed the weight, assist the person in moving to the height measure. Show the individual where to stand. Remind them to keep their feet together and flat on the floor. Encourage them to stand tall, looking straight ahead. Try to have them position themselves so their head and body touch the wall if possible. Tell them that you're going to move the measuring device so that it touches the top of their head before you actually do so. Patients in wheelchairs who cannot stand to be measured can use segmental height. This means you would use a tape measure to measure from the foot to knee, knee to hip, hip to the top of the head, and then add these together as an approximate height. As you walk your patient into the exam room, indicate where they should sit. Ideally, use a chair instead of an exam table if you anticipate there's going to be a wait before the doctor arrives. Ask if they have any concerns about checking their vital signs. Answer any questions they may have. You might ask the patient if they'd like to see your instrument before you actually use them. Let them touch or demonstrate the measure on a companion, a stuffed animal, or even yourself if needed. If the patient or their companion tells you that they have difficulty with any of the measures, you may want to defer that one until later. Many people with IDD struggle in particular with the tightness of the blood pressure cuff, or they might be fearful of a stethoscope. Encourage your patient to relax as best they can. Show them how to sit with their feet on the floor. Place the cuff on the arm and explain that the device is going to give them a tight hug of their arm for just a short time. Then you can inflate the cuff and encourage the individual to remain still. You may offer to help them by counting down slowly from 10 or 20 to help them get through the whole procedure. Offer an incentive if you need it. You should also praise any attempt at cooperation, even if they don't do a perfect job or you don't complete the exam. Approach the measurement of their temperature, oximetry, respiratory rate, all similarly. If you can't complete a needed measure, let the doctor know, and then you can plan together what you will do instead. As you ask your rooming questions, allow the patient to answer any that they can answer on their own. Ask for help from the companion if needed. When you have finished rooming, explain that the doctor will come in next. If the person needs to change into a gown for the exam, demonstrate proper gown placement and ask whether they need assistance. If there will be an anticipated wait time, inform the person and keep them updated during the waiting period. Notify the doctor when an individual needs special assistance, has been roomed, and whether they require some specific accommodations. Thank you for watching. To assist your patients in preparing for vital signs, you can refer them to the partner video at 4rhealth.org. Thanks.